So, I have a new job for you. But first, let me introduce you to our head of research.
Hello, my name is Dr. Robert Cromwell. Dr. Blaylock and Dr. Vaughn, I presume. It's nice to meet you. You must be busy adapting to Caduceus, as well as the newly established team. But the director recommended you to, so I would appreciate your assistance.
It's nice to meet you too. It would be our pleasure to help.
Good. I'd like you to participate in clinical testing under the supervision of the research lab.
Let me remind you that it is the duty of those in the medical field to not only cure patients, but to also research and pioneer new treatments. Doctors and researchers must work together to fight diseases both present and future. That's the purpose of Caduceus. There may be some interesting characters here, but they're all excellent doctors. I consider myself very fortunate to be able to conduct medical research among them. And on top of that, we now have the assistance of two truly gifted doctors with the healing touch. I firmly believe that with your precision, the data we'll be able to collect will be invaluable. That is why I'm so enthusiastic about your surgical skills. You don't have any objections, do you?
I appreciate your vote of confidence, even if it is a bit exaggerated.
He's a dedicated professional, although he tends to be long-winded.
Now then, there's an operation I'd like the two of you to perform. The research you're contributing to will give new hope to heart disease. I'll explain as I show you my lab. It's true that many people frown upon our astronomical research budget, mostly journalists and politicians who are trying to make a name for themselves. You know how difficult it is to produce significant results when conducting revolutionary research. But thankfully, we also have generous supporters such as...
Oh, Dr. Cromwell, you have friends with you today. Would you introduce me? Pretty please.
Isabella. You really should start acting more professionally. This is Ms. Vasquez. She's a representative of the Humani Corporation.
I'm Dr. Blaylock.
Dr. Vaughn.
Nice to meet you, handsome.
We're partnered with a number of large pharmaceutical companies and medical manufacturers, including Humani, who've been a tremendous help to us.
I hope my looks don't give you the wrong impression about our company. Humani is a major player in this industry, and I've been known to play hardball when needed.
Humani holds several lucrative pharmaceutical patents and leads the way in regenerative medicine.
Well, if there's anything I can do for you, just let me know.
We have a research specialist from Humani on staff as well. She's a very talented young woman and has produced great results. I believe she's nearby. Cynthia, can you spare a moment?
I'll go get her, Dr. Cromwell.
Thank you. I'd appreciate it. The operation that you'll be performing would not be possible without her help.
Yes, Dr. Cromwell? Oh, that's right. You said you'd introduce me to the doctors today.
This is Cynthia Kazakov. She's a beautiful woman, as you can see, and quite brilliant.
Cynthia Kazakov? You wouldn't happen to be from Trinity Medical School, would you?
Valerie? Valerie Blaylock?
Yeah, it's me.
You became a doctor! Congratulations!
Thanks. Wow, I never expected to see you here, of all places.
You're going to be helping us? This is great!
I'm Marcus Vaughn. Sorry to interrupt such a touching reunion.
Nice to meet you, Doctor.
So, you two are old friends. I have a feeling this will be a fruitful partnership. Now, Cynthia, can you explain to them about the cardiac patch?
Allow me to explain the details of the operation, as well as the usage of the myocardium patch. Our patient is a 10-year-old girl with an occlusion in her heart. Her heart functions are deteriorating. If this continues, she'll have a myocardial infarction.
That's where the myocardial patch comes in.
I don't know much about it. It's a form of synthetic membrane, correct?
Yes, it's a new type of synthetic membrane that uses the whole cell voltage clamp. The membrane itself is elastic and helps the heart move and function.
That's amazing. It truly is a miracle of science.
It's only as incredible as the skills of the people using it.
Nothing like a little pressure. I don't mind, though. That motivates me.
We'll do our best, of course. I can promise you that.
I'm glad to hear it.
So, we'll be applying this myocardial patch by positioning it according to the guide. Is that this operation's objective?
Yes, that's correct. This operation will be performed without stopping her heart. But I have faith in Caduceus and in all of you.
Let's start.
Let's begin the operation. We'll be operating on the heart. Please open her up. Let's confirm the procedure of this operation. 3 areas of occlusion have been located on the heart. We'll apply the myocardium patch to them all. Follow the guide and keep the placement and angle in mind when applying the patch. If the myocardium patch isn't placed correctly, the patient may undergo cardiac arrest. Be careful. Start by applying antibiotic gel to the occlusion area. The first myocardium patch will be applied here. Carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch has been successfully applied to the occlusion area. Her heart rate is increasing. There's a possibility that the already weakened areas of the myocardium may hemorrhage. If you find a hemorrhage, treat it with the antibiotic gel before its condition worsens. Here's the next occlusion area. What? The guide moved? Does this mean that we'll have to time the placement now that the heart is beating faster? Apply the patch when the size of the guide matches the size of the patch. Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her. We have a pulse. The patch wasn't placed at the correct angle. A blood pool is formed. Please drain it quickly. Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her. We have a pulse. The patch wasn't placed at the correct angle. Doctor, the patient's undergoing cardiac arrest. Let's begin the operation. We'll be operating on the heart. Please open her up. A blood pool. Doctor, the patient's use the defibrillator to resuscitate her. We have a pulse. Please watch the guide and place it when the sizes match. Doctor, the patient's undergoing. Use the defibrillator to resuscitate her. We have a pulse. Please watch the guide and place it when the sizes match. Doctor, the patient's use the defibrillator to resuscitate her. We have a pulse. Please watch the guide and place it when the sizes match. Doctor, the patient's undergoing cardiac arrest. Let's begin. We'll be operating on the heart. Please open her up. Let's confirm the 3 areas of occlusion have followed start by applying the first myocardium patch. Carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch has her heart rate. There's a possibility if you find a here's the next occlusion. What? The guide moved? Does this mean that we'll have to time the placement now that the heart is beating faster? Apply the patch when the size of the guide matches the size of the patch.
Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her.
We have a pulse. Please watch the guide and place it when the sizes match.
Doctor, the patient's use the defibrillator to resuscitate her.
We have a pulse. Please watch the guide and place it when the sizes match. A blood pool is formed. Please drain it quickly.
Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her.
We have a pulse. Doctor, the patch can't be applied over a blood pool.
Not yet.
The myocardium patch needs to be placed along the guide. Placing it there is useless. The second occlusion area has been treated. 1 more to go. Her heart rate is increasing. Be careful when placing the patch. Watch your timing.
Doctor, the patient's undergoing cardiac arrest.
Let's begin. We'll be operating on the heart. Please open her up. Let 3 follow the guide. If the start by applying at the first myocard. Carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch has been successfully. Her heart rate. There's a. If you find. Here's the next occlusion. What? Does this mean apply the patch when the size of the guide matches the size of the patch?
Doctor, the patient's undergoing cardiac arrest.
Let's begin. We'll be operating on the heart. Please open her up. Let's confirm 3 follow. If the start by applying the first carefully match the location and angle of the patch with a pattern on. The myocardium patch has been. Her heart. There's a. If you. Here's the next occlusion. What? The guide moved? Does this mean that apply the patch when the size of the guide matches the size of the patch?
Doctor, the patient's undergoing cardiac arrest.
We'll be operating on the heart. Please open her up. Let 3 follow the. If the start by applying antibiotic gel to the first myocard. Carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch has her heart. There's a pop. If you find. Here's the next occlusion area. Let's continue the operation. What? Does this mean apply the patch when the size of the guide matches the.
Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her.
We have a pulse. The patch wasn't applied to the correct area.
Doctor, the patient's undergoing cardiac arrest.
We'll be operating on the heart. Please open her up. Let's follow the start by applying the first myocardium. Carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch. There's a here's the next occlusion area. What does this mean? Apply the patch when the size of the guide matches the size of the patch. The second occlusion area has been treated. One more to go. Her heart rate is increasing. Be careful when placing the patch. Watch your timing. Doctor, the patient's undergoing cardiac arrest. Use the defibrillator to resuscitate her. We have a pulse. Please watch the guide and place it when the sizes match. Let's treat them all. The patches have begun synchronizing with the myocardium's movement, and her heart rate is returning to normal. She should be all right now. Let's close her up. Please close her up. We're finished. Good work, everyone.
That was a flawless operation. Simply perfect. The patch is sure to integrate with the existing tissue. The patient should recover nicely.
I think we'll see excellent results, Valerie.
I'm glad to hear that.
Yeah, I wouldn't mind doing more operations like this one.
Well, we wouldn't want to take up all of your time. The director has already spoken to us regarding the research on stigma. We're currently in the planning stages. In time, we'll show you what we're capable of. Right, Cynthia?
Yes, Dr. Cromwell.
The NIH has received a request for help from a hospital in Texas. They're having difficulty with the diagnosis. Based on the patient's chart, there's a good chance that it's stigma.
So this is what we're dealing with,
These two pictures were taken only a few hours apart. Look how far the focus is shifting. And its size has increased drastically.
A biopsy was attempted, but they were unable to obtain a sample of the pathogen. The patient will arrive in roughly 3 hours. Vaughn and Blaylock will be performing the surgery.
We'll check the patient's condition upon her arrival and then proceed with the operation.
We're treading on unknown territory, so we'd appreciate your support, Dr. Suji.
I highly doubt that you two will need my help, but I'll get ready nonetheless.
The patient's vitals are stable. Blood pressure 110/60, heart rate 60 beats per minute.
Any case history?
She was involved in an accident 2 months ago. Laceration on the right thigh. Looks like they used artificial blood for transfusion. Q-heme blood from Syntec Labs to be.
Are there any contraindications?
None that I'm aware of, but can you check with them just in case?
Will do.
The affected area is the liver. The course of treatment will be determined during the procedure. However, I have a feeling this will be different than the professor's case.
Even so, I'm sure our experience with stigma will prove invaluable. Let's stay positive.
According to the test results, this stigma is completely different from the one we saw before. There are some similarities, though, such as high mobility.
It tries every conceivable method to make its victims suffer. It's like a nightmare.
If it is stigma, then there must be a core somewhere, even if it looks different. If we can find and attack it, we may be able to identify the key to stopping it.
A core. Now that you mention it, there was something in the report about that.
That's right. We saw something like a core when we were operating on Professor Wilkins.
I'm surprised you remember, Marcus.
Call it a hunch.
A hunch? Well, at least we have some hope of defeating it now.
I'll be praying that I don't have to get involved.
It's haunting me. Wherever I go.
Dr. Vaughn?
It's nothing. Let's end this nightmare. Okay, let's begin.
The exact nature of this stigma and the types of damage it is capable of are still unknown.
We'll just...
Stigma confirmed. It's much larger than before.
That must be its core there in the center. The plan is to use the laser to incinerate it, but...
We can't do anything to it since the core has enveloped itself within the surrounding cellular tissue. The tissue itself looks highly viscous. Let's try...
Good job. The amount of cellular tissue around the core has decreased.
Okay, then let's continue this and... Is this a tumor? Let's burn it with the laser.
The core's been exposed. Use the laser to incinerate it. It's working! The core's being covered by the tissue again. Please drain it. There is still tissue left inside the patient. Please drain it. Just a little more.
Did it split up?
The core has to be in one of them. Use the drain to find it.
More of the tissue has been created. Drain it immediately. Vitals are dropping.
Is the tumor hardening?
The remaining tissue is...
Let's extract it with the Powell procedure. First, we can't use the drain
Vitals
on the
are
hardened
dropping?
tissue. Use the laser to soften it up.
The draining is complete. Use this. The tumor has been excised. Please extract it. The exact name.
We'll just have to open her up and observe it for ourselves.
Stigma confirmed.
That...
We can't do anything to the tissue itself. Looks...
Good job.
Okay, then let's continue this and drag the core out.
The core's been exposed. Use the laser to incinerate it. It's working.
Is this a tumor? Let's burn it with the laser.
There is still tissue left inside the patient. Please drain it. Just a little more.
Did it split up?
The core has to be in one of them. Use the drain to find it.
More of the tissue has been created. Drain it immediately. No presence of stigma can be detected, and no affected areas remain.
That was an amazing operation. Let's close her up and be finished.
We were able to deal with it. Somehow.
I hope this is the last time we have to perform an operation in the dark.
We're finished. Great work, everyone.
Stigma's mobility far exceeded our expectations.
You all did a great job treating it. I'm glad you're with us.
Would you expect any less from Caduceus' own special disease counteraction team?
We'll hold a conference on this case of stigma within the next few days. Of course, I'll need you to speak regarding today's operation and the patient's progress. Your report will also be forwarded to Health and Human Services, so please get started immediately.
Just give me a strong cup of joe, and I'll crank it out.
Good. You know, there was no way we could have anticipated stigma's metamorphosis. I was amazed at how well you adapted. I know you have the healing touch, but even so.
I guess I'm just lucky. The results from the liver exam indicate that the patient has been making satisfactory progress. She seems to be recovering well, but it's unclear how this disease was transmitted in the first place. We should continue monitoring her for at least another month.
I see. Well, I think it's safe to say that the treatment was successful. How about the pathogen itself? What have we learned? And please, keep it brief, Robert.
My pleasure, although our analysis is only partially complete. First, the biopsy. Stigma did not match any known organism, meaning it's a new species, so we'll have to come up with a name for it. So how about it, Dr. Everett? You'll be a grandfather one of these days.
Well, my son's only 12. All he thinks about is football.
Oh, well, in that case, I'll ask someone else. Now, regarding the spectral analysis, our attempts to determine its structure resulted in failure.
What? How is that possible? I've never heard of that happening before.
We tried a different machine, but the outcome was the same. We screened for nucleic acid, proteins, glucose, lipids, and ATP, but there were no matches. Stigma consists of an organic compound that is completely foreign to us.
What? This will change the way we think about life itself.
Whoever is credited with its discovery will surely make history. From a medical perspective, it's fortunate that Stigma's infectivity is weak. We're trying to culture it, but so far there's no sign of growth or multiplication. It's going to be difficult to determine the means of infection as well.
This is more serious than we thought.
Madam Director, we have an emergency. Leslie, we're in the middle of an important conference. Deputy Secretary Marshall has collapsed. He may have intraaxial hemorrhaging.
George Marshall, from the Department of Homeland Security?
All right, let's adjourn the conference. Leslie, I want you to prep operating room 3 for him. Vaughn, Blaylock, you two will be performing the procedure.
You want us to operate on a high-ranking government official?
I'll explain the details before the operation, so please go make the necessary preparations.
It's been 35 minutes since he collapsed. He's a 9 on the coma scale with mild tachypnea.
We're waiting on the CAT scan results, but it's most likely a case of subarachnoid hemorrhage.
This is his chart from his previous admittance. We performed deep brain stimulation to treat his dystonia.
And he was able to recover from that. Incredible. Looks like the system's produced by Columba and Cornix, the same company that made Elena's pump.
Yes, it's now a subsidiary of Humani. If you have any questions about it, you can ask Isabella.
Director, what's this shadow here on the X-ray?
Oh, that. It's a hippocampus chip. We implanted it at his request.
He didn't want to forget anything, so he opted to have his memory augmented. I assume they're keeping it quiet. Do we need to worry about being in violation of state law?
We don't have time to discuss that. Now, the hematoma is far enough away from the electrodes, but take care when using the thrombolytic.
Okay, we'll head over to the OR then.
These are the results from the CT. Please take a look. A number of aneurysms have been detected. Some of the blood vessels have already burst and are hemorrhaging heavily inside the brain. First, we must clear the excess blood from the area. Then we need to treat the aneurysms. Remember, this is brain surgery. Please be extra careful when performing this operation.
Even a tiny mistake could debilitate his brain. We better be careful.
This will require extreme delicacy and dexterity. We need to do our best.
All right, let's begin. Since we're operating on the brain, even the smallest mistake can be fatal. We'll have to be extremely careful.
That bulge on the vein is the brain aneurysm. Let's remove it before it bursts.
I'm getting the sedative ready. Please inject it directly into the bulge and let's detach it with the scalpel while the sedative is... The aneurysm has been detached. The aneurysm has been... Please hold the vein with the forceps and connect it before it hemorrhages. The vein has been reconnected. Please suture the vein together. We're done treating this brain aneurysm.
The test said there were multiple aneurysms, though.
There's a chance that any of these vessels will turn into aneurysms. Have the magnification tool ready. Let's shift our viewpoint when necessary and treat the aneurysms when they appear.
There it is. Let's treat it before it bursts.
There's more where we're not looking. Once we treat the ones in sight, we have to quickly change our focus.
The sedative's effect is worn off. Please inject it again.
Vitals are dropping?
The situation's calmed down for now, but his vitals aren't stabilizing. Let's wait a moment and see what happens.
Doctor, please hurry! If all of these burst at once... An aneurysm seems to have burst outside of our current view. Use the magnification tool.
That's enough. I can't stand by and watch any...
Since we'll have to be extremely careful.
I'm getting the sedative ready. Please inject it Let's detach it with the scalpel while the sedative... The aneurysm has been detached. The aneurysm has been removed. Please hold the vein with the forceps and connect... The vein has been reconnected. Please, we're done treating this brain aneurysm.
The test...
Let's shift.
There it is.
There's more where we're not looking. Once we treat the ones in sight, we have to quickly change our focus.
Vitals are dropping his burst. Quickly, drain the blood and reconnect the vein. The sedative's effect is worn off. Please inject it again. Once you pick up the vein with the forceps, pull it straight toward the other end of the vein. situation's calmed down for now, but his vitals aren't stabilizing. Let's wait a moment and see what happens.
Doctor, please hurry. If all of these burst at once...
Not yet.
That's enough.
For Dr. Vaughn and without a... they...
Since we'll have to be extremely careful.
That bulb...
I'm getting the sedative ready. Please inject it. Let's detach it with the scalpel. The aneurysm has been detached. The aneurysm has been removed. Please hold the vein. The vein has been reconnected. We're done treating this brain aneurysm.
The test said there were...
There's a chance, but
There it is.
there's more. Once we treat the ones in sight, we have to quickly change our focus.
Vitals are dropping. Doctor, please inject it into the bulging vein. The sedative's effect is worn off. Please inject it again. The situation's calmed down for now, but his vitals aren't stabilizing. Let's wait a moment and see what happens.
Doctor, please hurry. If all of these burst at once... seems to have burst outside of our current view. Use the magnification tool to find it.
Once you pick up the vein with the forceps, pull it straight toward the other end of the vein. His vitals are stabilizing. It looks like it's finally over. We're done here. Excellent work.
Columba and Cornix's brain electrodes and pump units may seem cutting edge, but it won't be long before they're made available to the general public. Just like the pacemaker, Professor Wilkins had one. Why do I have this nagging feeling? Everyone who's contracted stigma has had some kind of artificial agent in their body. Even that one patient who was transferred here had Syntex Q heme blood. I was using artificial blood with my test mouse, too. I wonder if there's a connection.
Dr. Vaughn, can I trouble you for a moment?
Of course.
I wanted to check on the Deputy Secretary's condition.
I doubt I can tell you more than you already know, ma'am. Since he was brought here promptly, cerebral ischemia was kept to a minimum. And there are no signs of severe paralysis, so we shouldn't have to worry about any after effects. We can't use the MRI, so we'll take another CAT scan tomorrow. Will you be advising on his rehab, ma'am?
Yes, I will. I also need to administer a personality test. Because of his implant, he must be closely monitored. It's sad, really.
Yeah, I feel sorry for the guy. But I'd like to leave him in the hands of the others so I can concentrate on stigma.
Agreed. And Dr. Vaughn, it's a shame that you feel the need to keep secrets from us. But I'm hoping that will change.
What makes you say that?
Your cutaneous muscles seem a little more tense than normal. I'm out of practice when it comes to reading faces. Was my assessment accurate? You're a critical part of the Caduceus team. I hope you're not thinking of leaving.
Of course not.
Hey! You there! Do you work here?
Who? Me? Well, yes.
Could you please take a look at my son? He's been complaining of terrible stomach pain.
You brought him here? We don't accept emergencies or walk-ins.
I heard this hospital is famous. And it's so big. There must be someone who can help.
Well, there's no point arguing about it. I'll take a look at him. What's your son's name?
Oliver. Oliver McHale.
You wouldn't believe the patient I'm dealing with. He's throwing a fit because his operation isn't expensive enough.
Are you serious?
Yeah, his friend just had a hernia operation that cost $40,000 and he doesn't want to be outdone. He's 11 years old and filling the role of a trust fund brat perfectly. I guess it wasn't enough for him that his father pulled some strings to get him into this place. He's the son of some big shot, and neither of his parents have the time to bring him here.
So how much are we charging him?
About $30,000. The operation will be performed in a deluxe suite. Not bad for a case of appendicitis, huh?
Appendicitis? What a coincidence. I'm seeing a boy with the same condition.
Excuse me, Dr. Blaylock?
Yes, Elena?
I have a message from accounting. They say to transport your new patient somewhere else. It seems the family can't afford the treatment. Since Caduceus isn't normally open to the public, they don't know how to deal with situations like this.
How much is it going to cost?
Well, the family doesn't have health insurance, so at least $10,000.
But transporting him now will put his life at risk.
Unfortunately, money talks, even when it comes to healthcare.
What do you think?
That's a tough decision. Marcus, have you given your patient his bill yet?
No, why?
Do you mind if I handle it? Chandler, I mean, Mr. Forbes, about your hospital bill. The total will be $30,000.
I told you, that's not enough. I can't lose to someone like Jimmy. His dad's just the president of some little company. I want a premium upgrade. Bring in like 10 doctors.
I'm afraid we can't do that. But there might be something else we can do. If you'd like to make a donation, we can increase your bill. How does $10,000 sound?
That's it? Well, how much would the total be?
That would bring it up to $40,000.
But that's the same as Jimmy's. That's still not high enough. I'm way richer than he is.
Well, we could add 2,000 more and make it 42,000.
42,000. Well, I guess that's okay. My daddy gives me whatever I... Oh! Ow! My tummy hurts! Hurry up and fix it!
We have the best room reserved for you, so let's get started.
Well then, the donation will be transferred from the hospital to the Oliver McHale Fund. Elena, prep for surgery. We've got 2 appendixes to remove.
Pretty sneaky, Val. To be honest, I'm impressed.
It still counts as a donation, so it's not going to cause us any problems, right?
It'll be fine. It's in both their best interests anyway, so it all works out.
Well, let's begin the conference. The first patient, Chandler, has acute appendicitis. It appears to be in its early stages, so the operation should be fairly routine. However, the second patient, Oliver, seems to have the same condition, but in an advanced state. It looks like he's been trying to hide his symptoms.
But he's only a child.
We understand the situation. This is going to be 2 operations back to back, so let's be quick. We're going to save them both, of course.
This boy's condition is relatively mild, isn't it?
It's still too late to treat it with antibiotics. It would be best to perform an appendectomy.
All right. Please begin the procedure. Please prepare to extract the appendix. First, inject the sedative. Next, We'll be cutting into the mesoappendix. Use the scalp. Next, we'll tie 2 wires around the appendix. However, they must be tied in the appropriate places.
One goes around the base of the organ, and look at where the wire needs to be. Then slide it down while pressing the A button. We're done tying the base. Now for the wire around the appendix.
Now that both parts of the appendix have been tied, make an incision between the 2 wires. Now that the appendix has been severed, please place it on the tray. The appendix has been successfully removed. To fix the membrane, looks like our first operation was a success. Let's close him up.
That went smoothly.
Let's move on to our next patient.
Doctor, we have a problem. Oliver's condition has worsened.
What?
What's his condition?
He complained of severe pain and then went into shock.
Don't tell me. His appendix has burst.
We'll find out when we open him up. We have to hurry and get in there.
The pus is causing inflammation.
It's peritonitis.
Treat the inflammation and drain the pus. The appendix needs to be removed as well. Begin with the sedative. This is bad. The appendix is festering. Please hurry up and extract the appendix. It's secreting pus. The appendix has been extracted. Don't place the membrane over the pus, Doctor. Please drain the
Patient's vitals.
The synthetic membrane has been affixed. Let's treat the remaining wounds. The appendectomy is complete and the peritonitis has been treated. Let's close him up. This boy is very lucky. If he'd waited any longer for surgery, he may not have pulled through. Well, let's close him up.
rich or poor, we're all the same under the knife. I never thought such a simple operation could put me on edge like this.
I think we've all learned something from this operation.
Thank you so much, Doctor. You saved my son's life. But I thought that this hospital didn't treat normal patients.
Well, it was an emergency, so this was a special case. Thankfully, an anonymous donor paid for your treatment fees.
I can't believe how fortunate we are. That donor must be an angel.
Yes, well, please see to getting your son health insurance so he can get the medical help he needs.
Okay, I will. Thanks again.
You're welcome. Take care now.
You're very good with children, Dr. Blaylock.
Thanks. I did some volunteer work at an orphanage. How about you, Marcus? Who are the lucky beneficiaries of your time?
I didn't do any volunteer work.
Really? I thought that was a requirement for all doctors. He's so self-centered. Drives me crazy. I haven't heard from him in I don't know how long, and now he's telling me to come to Philadelphia. He's got some nerve. It's like he thinks we're still dating.
That's just his personality. It can't be helped. Besides, you already said yes, right? You're not on call, so why not? Think of it as a little vacation. A chance to reminisce about your college days.
How stupid of me. When I heard that he'd found a new type of parasite, I agreed to go without thinking. That reminds me. How are things between you and Ray?
It ended when he went back home.
Oh, sorry. I shouldn't have brought it up.
Oh, it's all right. If you're so worried about this trip, then why don't you bring Dr. Vaughn along? He has some time off too, doesn't he?
I don't know if that would be such a good idea. I'm sure he wants to get some rest.
I think he'd be interested in going. It sounds like a fascinating discovery.
You think so?
Thanks, but I'll pass. Philadelphia's too far. It'd be a waste of my vacation. Besides, Robert finished his report on stigma, and I'd like to review it.
Oh, come on, don't be that way. This information will be useful for you.
If it was that important, Caduceus would be all over it. A parasite isn't going to help us understand stigma any better. I have no interest in a new variety of hookworm.
You're going to drive all the way to Philadelphia?
That's the plan.
That sounds like fun. I haven't been on a road trip in a long time.
Really? Then would you like to come along?
Are you sure it's okay?
Of course. The more the merrier. I'll tell Denny it's a field trip for Caduceus Special Disease Counteraction Team.
Hey, I didn't say I was going.
What are you talking about? This is a team effort. I won't take no for an answer. We're all going to Philadelphia this weekend. That was an interesting operation, wasn't it?
I suppose. It would have been a lot more interesting, though, if the operation hadn't been performed on a dog.
Oh, don't be so cranky, Marcus. How was I supposed to know that Denny decided to become a veterinarian? He tried to be a nice host, right? Even if he didn't exactly succeed.
Look at that guy. He's driving like a maniac. I hope he gets pulled over.
Well, I thought it was worth the trip.
Really? Me too. I'm sure what we learned will come in handy someday.
Yeah, like if we ever have to save a celebrity's pampered pooch. I never should have let you talk me into this.
All right, I'm sorry. I wasn't thinking straight. I mean, how would you feel if your college ex called you out of nowhere?
I totally understand. Just ignore him, Dr. Blaylock. Hey, what's with that police car?
There's been an accident. Stop the car.
Today's just not my day. It's worse than I thought. Someone was thrown from the car.
It seems he was the only one inside.
He's breathing, but he's unconscious. The wounds on his chest are pretty bad. He's not looking so great.
I brought a set of instruments. Let's get ready.
We're going to operate here?
We'll just perform first aid. He may be suffering from damage to his internal organs.
Well, this has turned out to be one hell of a road trip. This is an emergency. We have to stabilize him.
He appears to have sustained serious blunt trauma to the chest.
We need to treat these external wounds first.
We've treated his his external wounds, but his vitals aren't stabilizing. There's probably some internal bleeding. Please open him up.
This doesn't look good.
Please, use the antibiotic gel before the hemorrhaging worsens.
His vitals still aren't stabilizing. We must have missed something. We'll have to use the magnification tool.
We've treated all the wounds, but his vitals still haven't... Doctor, something's wrong. The hemorrhaging has formed a pool of blood. Doctor, the shadow has disappeared. A laceration has formed. The hemorrhaging's gotten worse. It appears that blood has collected in the thoracic cavity. Please hurry. Doctor, this is too much for us to...
He appeared...
We need to treat these external wounds first. The patient's vitals.
There's probably some internal bleeding. Please open him up. Please, use the antibiotic gel before the hemorrhaging worsens. Use the forceps once you've drained the blood. Quickly use the forceps to close the laceration. That was the worst one. Let's treat the other wounds now.
His vitals still aren't stabilizing. We'll have to use the magnification tool.
We've treated all the wounds, but his vitals still haven't stabilized.
The patient's vitals.
Doctor, the shadow has disappeared. Please use the ultrasound. The hemorrhaging's formed a pool of blood. A laceration has formed. The hemorrhaging's gotten worse. Doctor.
For the without they.
He appeared...
We need to treat these external wounds first. The patient's vitals.
We've treated his There's probably some internal bleeding. Please open him up. Please, use the antibiotic gel before the hemorrhaging worsens.
His vitals still aren't stabilized. We'll have to use the magnification tool.
We've treated all the wounds, but his vitals still haven't... Doctor, the shadow is... It appears that blood has collected in... Now...
The patient's vitals.
Doctor, there may be other pockets of blood. Keep searching.
Not yet. vitals are stabilizing. He should be all right now.
Okay, let's close him up. If we hadn't decided to operate, he never would have made it. Well done, you guys.
I'm done transferring him.
Well, we at least accomplished something worthwhile on this trip.
Yeah, he's one lucky guy. How many officers can say they've received roadside surgery?